absolutely no question that breastfeeding provides the best possible nutrition for a child at any given moment, but also has direct beneficial effects in protecting children from infectious diseases.
Anyone from our guest speakers would like to add something? No. Okay, so I will read one question that came from Peter Schelling, who works with the European news agency ENA. What's WHO recommendation on the vitamin A supplementation for preschool-aged children in the context of COVID-19?
We should continue providing vitamin A. It's an important vitamin deficiency that can be prevented by supplementing vitamin A, and there's no reason not to do so.
Okay, thank you very much. So we will try now to go to next edition newspaper in Nigeria, and we have Adeze Oyokwu with us. Adeze, please unmute yourself.
Okay. Yeah, thank you very much. Yeah, my question is on easing lockdowns in African countries due to poverty and pressure from business owners. My question is to you, DG, should African governments ease lockdown now because infection is still rising? And this situation may affect mothers and babies, considering that the health systems in Africa, especially in Nigeria, are very, very poor, and that in traditional societies and rural communities, women bear the burden for caring for the home. So how do African governments, factor in the role of women into this COVID-19? These are even the SDGs. Thank you for having me.
Thank you, Adeze, for this question. We had a very bad sound, but if I understood the question, it's how African governments should deal with easing the lockdowns in the context of increasing number of infections and the consequences it has on women and children.
So thank you for this very important question of, balancing the need to suppress and control the virus while trying to lift some of these lockdown measures and resume economic and activity, especially for mothers and children and for all. So we have outlined different ways in which we can support governments in taking decisions on when and how to lift these public health and social measures, or these so-called lockdown measures. And primary to this is to really understand the transmission. Is the outbreak in that area, in the area that we're talking about, controlled? Do we have a system in place? Is there the public health infrastructure in place to be able to detect cases and test for cases, care for those cases, find contacts, quarantine those contacts? And making sure that not only the public health infrastructure is in place, but the health infrastructure is there as well, to care for those who need care for COVID-19, as well as other medical conditions, including those for women and children and adolescents. Making sure that in situations that the risks for high vulnerable settings are minimized, so that we don't have any hotspots of activity where the virus can really resurge very, very quickly. When resuming work, making sure that the workplaces are ready to be able to receive people back to work safely, where these public health measures can be in place within the workplace facilities. And that communities are fully engaged and understand how the resumption of and the lifting of some of these lockdown measures can be put in place. Balancing that with trying to get people back to work, but ensure that the virus does not have an opportunity to resurge. We are learning from a number of countries who are trying to do this. They're doing it in a very slow way. They're doing it in a controlled and a deliberate way. where maybe the resumption is not happening all at once in a country, but it's happening in different parts of a country, perhaps where the virus is actually controlled. And we are looking to do more in-depth work with countries to better understand how they've done this. Not only how these measures were put in place, but how they were lifted and how they are done safely.
Thank you very much, Dr. Van Kerkhove. Our guest speakers, if there is anything you would like to add, so just please proceed right now. If not, we will go to next question, and next question comes from India, and we have India TV, and we have Nidhi Taneya with us. Please unmute yourself. Hello. Do we have India TV online? Seems it's not the case, so we will go to Bayram, our Geneva-based colleague from Anatolia News Agency. Bayram.
Thank you very much for taking my question. Mr. Tedros, do you think there is a danger it could trigger a second wave of COVID-19 outbreak? And are you optimistic that the pandemic will be under control in Europe and the rest of the world by the end of 2020? Thank you so much.
I think, well, first and foremost, most of the world right now is still very much in the throes of the first wave of this pandemic. Some countries in Europe, in Southeast Asia, North America, have been through the peak of a wave of infection and are slowly, carefully making their way out of that situation. Some had to entirely shut down their societies and economies to achieve that. Some have managed to avoid that. The current uptick in cases in some countries can be represented, yes, as a second wave or a second peak. In other words, that the disease has not reached a very low level, maintained a low level, and then come back sometime later in the year. This is possibly in some countries related to reopening of society, remixing of people, and being in a situation without adequate social distancing, without adequate measures in place, and without adequate capacity to isolate, test and isolate suspect cases and quarantine contacts, the disease can return again. And we've certainly seen a number of countries where that phenomenon has happened, not necessarily at a national level, but in terms of a sub-national level. And countries have been working hard in Southeast Asia and other places to identify new clusters of disease and to break the chains of transmission. So it's not surprising at all that any country coming out of a so-called lockdown can have clusters of disease, re-emergence of disease in clusters. That's not necessarily a second wave. That is just a result of many of you as journalists have asked us. There is a careful balance to be struck between keeping everyone at home and continuing to completely suppress transmission of COVID-19 and the untoward effects of that on the economy and society. And that's not an easy balance. This is a public health dilemma, and it's one that has to be carefully managed and balanced by every government every minute of every day. And there are no correct answers in that regard. There is no playbook that can be written at global level for each and every country in that circumstance. Countries have to balance those things. So yes, we are concerned that we are still very much on the upswing of this pandemic in many countries, particularly of the global south. We are concerned that some countries are having difficulties in exiting the so-called lockdowns as they're seeing increases of cases again. And the responses in that regard for countries are going to be, are there alternatives now to controlling that uptick in cases, short of implementing full lockdowns? Can countries engage in a much more micro process? Can countries identify exactly where they're getting an increase in cases? Can they apply measures there and avoid applying measures in areas where they're not seeing that? And that comes down to the granularity of your data. Do you know where the virus is? Can you tell specifically where the virus is increasing or decreasing? Do you have that knowledge? And within that, can you make an intervention at a geographic level that allows you to take sometimes increased measures without affecting the whole population? And that really comes down to the sophistication of your public health surveillance, your ability to test, track and trace, your knowledge of the virus as it's spreading through communities, and your ability to apply measures in a way that's not a blanket measure, that you can lift and adjust measures at a sub-national or a sub-state level that allow you to be much more sophisticated in doing that. But that is driven by having good data. And without good data, it's almost impossible to take that approach. So, as we've said previously, a comprehensive approach, strong public health surveillance, know where the virus is. If you see a rise in virus in a given area, strong cluster investigation, understand the risks, try and break those chains of transmission. And in a sense, we've said this, there must be an alternative to lockdown, because in the absence of lockdown, the virus will tend to spread again. So the question is, what have you got to replace lockdown with? And what we have now in the absence of a vaccine is good public health surveillance, a strong relationship with communities, so they know how to protect themselves and they're empowered to protect themselves. They're given the resources, the education and the materials to be able to do that, and that we in the health sector support them by putting in place the necessary surveillance, and we apply measures in as much as possible, the minimum measures to control the disease at the lowest possible level geographically. It's very easy for me to sit here and say that that is difficult to achieve in any circumstance, but it is the only way to sustain the next number of months while we wait for other interventions. And again, we have to say that we really hope we have an effective vaccine in time, but there are no guarantees. So I've said it here previously, we have to learn to live with this virus. We have to find a balance of controlling this virus against the damage economically and socially of controlling this virus. This is a difficult dilemma, but we must find that balance, and each society must find that balance which is in accordance with its values and what citizens in that country wish to achieve as a collective, and that's not always so easy to achieve.
Yeah, thank you, Mike. And there is another dimension I would like to bring to this question. We're truly concerned, actually, because the world is divided. The world has never seen anything like this since the flu in 1918, which is more than 100 years ago. This is a very dangerous virus, and it's very hard to fight this kind of virus in a divided world. That's what we should understand. And that's why, from day one, we have been calling for national unity and global solidarity. And we need these two in order to have a better outcome, like you said, by the end of 2020 or any time soon, can happen with unity and solidarity. But it will be difficult.